Hey everyone, this is Tom Salemi of Device Talks. Welcome back. I hope you had a great Thanksgiving break. Happy to bring you this podcast episode. We're going to focus on Stryker today. I spoke with Andy Pierce. Andy's the group president of the MedSurg and Neurotechnology business at Stryker. And then later on, I reconnected with Kevin Lobo, chair and CEO of Stryker. We covered a lot. Stryker had its analyst day recently, like in past Device Talks podcast episodes when we focused on different technologies and different conditions. This week, we're focusing on a specific company. The company is Stryker. So it's a really kind of cool way to take a deep dive on a single company. And we dove pretty deep. We covered a lot of issues in Stryker. We talked about the Wright acquisition, the integration going well. We talked about MAKO and sensors and how Stryker is working to address a shocking problem. Shocked me, the deaths associated with post-partem hemorrhaging. So lots to talk about. In the later interview, Kevin Lobo will talk about IPO windows and the state of innovation. So we really covered a lot. And I know you'll enjoy these two conversations. But before we roll in, I wanted to invite you to our Device Talks Tuesday discussion coming up this Tuesday. It's really something that if you're interested in surgical robotics, you should check it out. It is sponsored by SHOT, and the title is How Advanced Visualization Technologies Are Driving Robotic Surgery. So we're talking about visualization. We'll have Tony Capobianco from SHOT, but we'll also have Tom Califf. He's a Chief Technology Officer at Active Surgical, which is a very cool company. We had the CEO on earlier this year. And we'll also have on this panel Alex Shannon. He is the Senior Director at Medtronic Surgical, who's working on their robotic system. So check it out. Go to devicetalks.com. You can register there. You can watch it live at 4 p.m. on Tuesday, or you can watch it on demand. Also, we'll be dropping an episode of the Intuitive Talks podcast next week. So check devicetalks.com for that. Or, of course, you can subscribe by subscribing to this podcast channel, the podcast channel for Device Talks Weekly. That'll send you the Intuitive Talks podcast as well. All right. That's it, folks. Let's go. All right. You ready for this?
Ready.
Chris Newmarker, how are you, sir?
Doing well, man. Doing well.
Holiday season is upon us. Happy Hanukkah to all of our listeners who are celebrating this week. And of course, we're getting ready for our own hotels a little later down the month. I'm drinking my coffee. I've got a little oat milk eggnog in there.
Oh wow!
Yeah, a little bit of zhoosh, a little bit of flair, a little bit of holiday cheer. Yeah.
Sounds good. I cut down my own Christmas tree this year.
Whoa!
I know.
Did that require heavy equipment?
They had saws there, so we didn't have a Griswold moment. So yeah, it was fun. Go to Christmas tree farm, pick out your own tree.
Yeah. We got ours on Sunday as well, just because there was talk of Christmas tree shortages. I'm skeptical. We'll see.
There were plenty of trees growing.
I'm told
at the farm. There are plenty of pine trees growing around here in Minnesota. So
I'm told we may have a dearth of trees in New England. So I got mine just in case. I bought 5 of them just to hoard them because
you're hoarding pine trees.
No, I'm joking. We just got the one. And I had to run home to meet someone who was looking at our trees, coincidentally, and there was a pie waiting for me, Chris Newmark.
Wow!
Thank you for the chocolate cream pie. That was very kind of you. Yeah,
it's from Betty's Pies. Like our Minnesota listeners will appreciate that. So.
This podcast is brought to you by
Betty's Pies.
Thanks, Betty. I can't wait to have the pie.
I'm sure Betty's Pies way up there in Two Harbors is appreciating the free advertising.
But you can vouch for these pies. You actually sent me one of these pies last year. I remember being delicious.
Yes.
Yeah.
No, my pleasure, man. It's awesome, man. It's nice to spread the holiday cheer and
enough holiday cheer. Yes. I think we have some news to share. Let's move on to number 5 on the Newmarker's Newsmakers list. What do we got?
All right. Number 5 on the list. This was interesting to me because it's gotten thousands of page views on Mass Device, but this is in the CT platform world, which we don't talk about as much on here. But GE Healthcare unveiled CT, man. let's represent. But GE Healthcare unveiled a new CT platform with it's got what they called like a built-in scalability, that you can like upgrade the hard way without like replacing the gantry. And I think what makes this really interesting for readers is that they're making a play here to save hospitals money pretty much. I mean, this is like something like, look, you don't have to like replace a ton of stuff every time you want to upgrade your CT system. Like we've got it right here, this modular CT system.
Good stuff, and important as well. And Lord knows we need more accessible CT scans. So anything that works.
Yeah, we're definitely trying to make healthcare more affordable here, here in the U.S.
Absolutely. So, let's roll on to number 4 of the Newmarker Newsmakers.
Yeah. Number 4, this was interesting because this is Best Buy, which if people don't follow them a lot, they've really been making a big play with digital health. And in recent years, their top executives see it as one of the things, it's going to be a big part of their business in the future. Like even like you get hooked up with a lot of, digital health at your house, and, someone in the Geek Squad could help hook it up for you, which is especially good if it's, somebody who's a senior who might not, understand how to hook up all that kind of technology. So, but they spent $400 million to acquire Current Health, which has offices in Boston and Scotland. And they've got, this whole digital health hub, including like a, wearable vital signs monitor, home hub, links in with the, with the health providers, electronic medical records. Yeah, just a really, really interesting acquisition. I think a lot of our listeners, their companies a lot of times are selling to health providers, but we've got this direct to consumer option that's growing, and this Best Buy acquisition is symbolic of that. Yeah,
this is in the article written by you, Chris Newmarker.
Somebody, yes.
Sorry, I had to scroll down.
It's very, very familiar person.
You had the quote by CEO Corey Barry saying that we'll be able to create a holistic care ecosystem that shows up for customers across all their healthcare needs. And it makes the most sense. The hospitals are terrible at rolling out new tech and sort of engaging with patients. I just signed up for my patient hub a year or two ago, and it's rather antiquated. So these kind of reforms definitely will come from the retail sector, where they know how to do this stuff. They really do.
Well, and Best Buy's thing has always been like, you go to Best Buy, you're going to get experts who can, tell you what you need, and and you don't know how to hook something up in your house, they'll send the Geek Squad over. So there you go. You need, your health providers telling you need a lot more monitoring in your house, like for whatever, and that you can get hooked up for that at home.
Well, Andy Pierce, welcome to the podcast.
Great to be here, Tom. Thanks for having me.
It's my pleasure. So I've been watching the Analyst Day presentation. It was very good. I was wondering, was that your first time standing in front of a crowd post-COVID? Have you been to other meetings, or is this the first time you're actually seeing people in person, or have you been out there already?
Well, I don't know if it's post-COVID, but post-COVID being introduced to the world, sure.
This stage of COVID, yes.
This stage, yeah. Well, we have had a number of different Stryker activities, small groups, of course, conducted safely. But this is the first time in front of a group that large, yes.
And how did it feel? It's nice to get out there again.
It felt wonderful. It is always energizing to be around any humans these days, but particularly people in our industry that understand what we're doing, and to share a little bit about our company is always really fun. We're proud of what we do.
Excellent. Great. I want to pursue more questions about the company, but first I'd like to, as I always do, I'd like to find a little bit about our guest's background. Specifically, how did you find your way into the medtech industry?
Sure. Yeah, I was a very early starter at Stryker. And Stryker was my first company post college.
Wow.
And actually continues to be. That's why I'm here. And I never left along the way and came back. So just over 25 years with the company. And long story short here, I grew up in Western Michigan in a house where my father was actually a small town family physician.
Oh.
So I saw how hard he worked and chose to not pursue becoming a doctor, but was very interested in finding my way in some way, shape, or form into the medical field. And believe it or not, Stryker really was not a household name, even though we were in West Michigan at the time, and showed up on campus. I went to a small college in Western Michigan, showed up on campus to recruit, and I signed up. And as they say, the rest is history. I fell in love with the company, the people I met, the culture, what Stryker stood for, also being founded by a small town West Michigan physician. So it all lined up, and here I am.
That's fantastic. No, it's a great origin story. All right, well, let's start. Let's drill down on the business a bit. Talk a bit about the MedSurg and Neurotechnology group. It's a very you have a wide portfolio covering a lot of different areas. Maybe we can kind of tick through some of them.
Sure. I love talking about our business because we do so many amazing things for our customers to help them serve their patients. But for the outside world looking into Stryker, it's a lot easier to understand hips and knees or spine implants or trauma than it is to look into MSNT and sort of decipher what we do. The group is pretty big. We have 6 different operating divisions that are within the group. And in those operating divisions, we have 13 individual business units. So our org structure, Tom, is that we have 2 groups in the company, operating groups in the company. We call our commercial businesses, orthopedics and spine, that's run by my counterpart, and MedSurg and Neurotechnology, that's mine. And we structure underneath that our operating divisions, and within our operating divisions are those business units. So as I said, 6 different operating businesses in MedSurg and Neurotechnology, and 13 business units, very specialized. And we address about 19 very specific market segments within those business units in terms of the product categories that we compete in. And we have a number of different ancillary products as well. But that's the group. And I think on average, it's somewhere in the ballpark of about 60% of Stryker's annual revenue.
Okay, great. And those businesses I want to focus a bit on some of the programs you're working on, but looking a little more about the businesses. I remember in the presentation you were talking about your efforts in R&D and M&A, and we can talk about maybe M&A strategy in a bit, but each of those 13 businesses, they all have their own R&D departments. They all have their own M&A groups. How do they work together, or how do they work independently?
Well, they're quite independent, and we like our structure. It's very entrepreneurial the way Stryker operates. If you can imagine, to a degree, our corporate office, which I'm part of these days, operates more or less as a holding company. There's not an extensive amount of operational activity that happens out of corporate. All of the action, if you will, happens inside of our businesses and at the business unit level. And we provide a tremendous degree of autonomy to our businesses to make decisions on products that they choose to develop, products that they choose to acquire, or companies that they choose to acquire. And we expect a lot out of them. We expect growth. We expect them to win in the marketplace. We expect them to dazzle our customers and deliver for the company, but we give them a lot of leeway. So the domain expertise that's developed within those teams to understand their technology, the procedures that they are addressing, and just generally their markets, their competitors, their customers. And with that comes very independent budgets. So they're able to allocate as appropriate themselves within the division, within the business unit, and put those investments to work to deliver on our mission as a company. Occasionally, we have cross-divisional or cross-business unit activities that are M&A based or are platform development and R&D. And we have very collaborative leaders in the company that come together as appropriate, align around those priorities, and help our businesses to actually deliver on cross-business initiatives. But most of the activity, if you look inside the company, happens directly within the business unit. They run their businesses every day. As I said, very entrepreneurial, a lot of autonomy to go out and execute what they need to win.
So let's talk about one of those broader programs. I don't know if it fits under the suggestion you had just offered, but your Journey to Zero initiative. Is that something that covers all of your businesses and that is a priority for all? Talk a bit about the program and sort of how does it fit into the corporate structure?
Sure. We have a broader initiative in the company that we call Safety and Outcomes. Mm-hmm. And that is helping our customers to achieve their mission to provide safer, better care for patients. And of course, with that also comes safer, better working environments for our customers themselves. So each of our businesses in the Journey to Zero, nearly all have some role in that. And if you think about what the Journey to Zero actually is, this is a concept, an initiative that's been championed by the Joint Commission for 20 plus years around providing safer patient care. Mm-hmm. And if you look into Stryker and you understand our history, patient safety, caregiver safety is in our DNA. The founder of our company, Dr. Stryker, his first invention was the turning frame, and that was all about making life better for patients that were immobilized by easily turning them so they didn't develop pressure sores, pressure ulcers, and making life easier for the caregivers to actually turn patients very simply with a turning frame. And from there, whether it was his inventions or inventions that we have in the company ourselves organically or inorganically through our M&A processes, we are always seeking to help our customers achieve their mission of safer patient care. The Journey to Zero is quite specific, though. That is around never events mm-hmm. that are well-defined. So, for example, hospital-acquired infections or patient falls, things like that our customers are trying to achieve for their patients and for their employees. And so we have a number of different product categories that are quite specific. So if you look into our bed portfolio, it's really built around, it's not just a bed that a patient lays in, but how can that bed provide safety features so that we can minimize patient falls out of those beds. If you look at never events like HAI, or hospital-acquired infections, we have a great portfolio in our Sage business that addresses that. And there's a number of different types of products, all the way down to very specific products, say, for catheter-acquired urinary tract infections. So we have a real ethos in our company that is driven to seek out products, again, whether that's organically or inorganically, that help our customers achieve zero harm for their patients.
So looking at the territory that Stryker products cover within the healthcare spectrum, and you had a slide up there during the presentation where basically from the moment there's an event to getting the patient at home after the hospitalization, Stryker sort of has a presence in all of that. How do you see things developing in that sort of continuum of care? We keep hearing about the movement to get care out of the hospital, to have more hospital at home. How does Stryker sort of look at that dynamic and that change, and how do you respond to that as a business?
We certainly want to meet the patients where they are,
right?
And in some circumstances, like you're describing, help transitions as well as if there are safer sites of care, for example, or less expensive sites of care. So, for example, moving patients out of the hospital environment, which is quite expensive, into the ASC, from the ASC to the office. And over time, there very well could be some of our patients that move from the office environment actually to home care. Mm-hmm. And we do have a few products today in our Sage business around infection control that are actually used in the home environment. But we are definitely seeing transitions relative to sites of care and are working hard to be part of that transition, particularly from the hospital into the ASC environment. But if you look into our ENT business, for example, a number of those procedures which we are helping to move from the ASC to the office, which is an even lower cost environment and actually more convenient even than the ASC, which is quite convenient relative to the hospital environment for the patient. we're helping those transitions occur. And again, I think that goes to our deep specialization, that we can operate and meet those patients where they are, operate within that continuum of care, all the way from an event, like you said, if there's a car accident on the side of the road, a patient needs to be transported or cared for in the back of an ambulance, all the way, as noted, into that home care environment. One of the really unique aspects about our company is we have specialists in our company that follow all through that continuum of care for our patients and drive innovation in each of those steps along the way.
How does Stryker identify where the patients are and where they want to be met? There was discussion about your R&D and your marketing working with physicians. I'm kind of wondering what that process is like to meet with your customers, be them physicians, or at least understand where the patients are through the physicians, and understand we can change this product to make it do this or to allow it to be done there. Can you just sort of describe that process a bit? What is that relationship like between Stryker and the customers that help you sort of develop your strategies or your next products?
Sure. Yeah. So it's a wonderful question. We have domain expertise, as I mentioned, by specialty. So let's say we have deep domain expertise, as many know, of course, in orthopedics across our company. So yeah, sure. We understand the specialty well. We make products that help our specialists perform care for patients. But that's traditionally been in a hospital environment. If you just look at the orthopedic patient, the hospital environment has certain advantages. Let's say space is one of those for reprocessing or sterile processing of products that maybe an ambulatory surgery center doesn't have. They have less space, they're smaller. So we'll work in that case, not just with the clinical specialty, but the business side and the ASC to say, what are your pain points to performing patient care that maybe today is being done in the hospital environment for various reasons that could be done in the ambulatory environment, same-day surgery, if you had innovation that did X, Y, and Z. For example, if you cut down on the number of instrument trays to perform a total knee, what could we do there, and what innovations could we bring you to help accelerate that transition to a lower cost, more favorable site of care for the patient? So we're always seeking not just that clinical side, but the realities of the operational side of providing patient care and how we can help accelerate those journeys in healthcare and frankly, be on the right side of healthcare. What
is the relationship like with the ASCs? You had a panel of three surgeons who were owners or co-owners of ASCs on stage at your meeting, and I'm forgetting the gentleman's name who moderated the panel, but you have a specific business that's targeted toward engaging and serving ASCs. How does that describe what that organization is, and how does it fit into Stryker?
You bet. So one of the also unique things about our company is we do operate quite independently. So this decentralized structure that we have is not just the 13 business units inside of MSNT, but an additional 9 if you look in our orthopedics and spine business. So 22 separate business units calling on the ASC customer. The ASC is a little different from the hospital. The hospital has specialized service lines and leaders in each of those service lines, and they can handle on the business side doing business with a larger group of Stryker professionals. On the business side at the ASC, oftentimes you have a single point of contact that wants to engage with companies like ours. So we can be quite complex in that environment. And we recognize that trend over time, that care was moving to the ASC. In fact, Stryker has a long history of products being used in the ASC. But the trigger of the total joint over the last several years, moving from the hospital to the ASC, really drove us to say, how can we be easier to do business with the ASC customer? We know that we have a compelling portfolio for the ASC customer. If you look, we're almost a one-stop shop for what they need, whether that's in the ENT space or sports medicine or total joints, even in the general surgery world. But doing business with us isn't always the easiest thing. And that's why we started the ASC business within our company. And that is to provide a single point of contact for the ASC business decision maker to engage with Stryker and structure their deals, structure their programs with our company. And it's worked out tremendously well. Now, we also maintain specialized clinical selling and service. So the ASC customer still loves having that specialized sales rep that understands power tools or the total joint showing up and helping them achieve their goals clinically. But having that single point of contact to make Stryker easier to do business with has been a huge benefit for our customers.
Interesting. I'm just going to hop around just a little bit. I spoke with Kevin Lobo. The interview will be in this podcast episode. We talked in watching the Analyst Day presentation. There was a discussion about the hospital bed, and it never occurred to me before that the hospital bed, as simple as it may sound, is actually such an important point when it comes to data collection and patient monitoring, and the innovation that can be done with even something like that. Can you talk a bit about your bed program and sort of what does the hospital bed of the future maybe look like? Like what's the potential functionality in the future?
Sure. Yeah, Tom, I think the future is now. A hospital bed, as I noted earlier, certainly is a place of comfort for a patient. But with that, time in a hospital bed can actually come some dangers for the patient. So whether that be pressure injuries that can happen from being on your back or side or wherever it might be, where you have bony prominence too long, say in the heel or in the sacral area. And the bed now can tell the caregiver when that patient needs to move, when they've been in a certain position too long. The bed can actually tell the caregiver through some of the technology that we have that a patient may be moving in a way that they could potentially fall out of the bed. And it'll set certain alarms. The bed can help with all of the equipment that's in a room to funnel information to the nursing staff as to what might be happening with that patient's vitals, for example. So there's a number of different things that the bed is capable of doing today, and it's just been a wonderful. Our newest bed, ProCuity, has been a wonderful option for our customers. And if you think about just simple mechanical aspects of having a bed that's really low to the ground. So if a patient is a potential for a patient fall, somebody that's moving a lot, then you can drop that bed really close to the ground. And if they do fall, then of course the injury is hopefully going to be nothing, but it certainly would be much less if they're high up. So another aspect of that bed is wireless connectivity. So we certainly hear about wireless in our personal lives, and wireless has moved into the hospital environment as well. So wireless connectivity for nurse call, for example, is something that bed offers. So lots of different types of technologies that are being introduced through the bed to help provide better patient care.
Well, looking forward, what sort of innovations will we see coming out of your businesses? What do you think is particularly exciting that will help patients, will help physicians, and will just kind of move the healthcare sector forward?
Sure. I would say, Tom, that we have really amazing innovation happening all throughout our company, and specifically within MedSurg and Neurotechnology. Again, our structure drives this deep domain expertise. So you have professional marketers, R&D professionals, business development teams scouring the world for opportunities that may exist outside of Stryker with domain expertise in their space. And what does that mean? That means that, say, if you're in the bed business or you're in the power tools business, you know everything there is to know about activities that are happening outside of our company. And probably the most important is the challenges that our customers face when they're using those products and the types of procedures that is what they're trying to accomplish with those products. So there's no perfect product yet. We believe there's innovation to be had everywhere. We do not believe that there is such a thing, at least in our world, of commoditized products. And we seek opportunities to improve all of the time. Now, really neat products that are happening. We just introduced that are coming to market. We just introduced in the US our in-space balloon for irreparable rotator cuff repair. This is an amazing technology that patients really don't have great options for irreparable rotator cuff repair. So if you think about these patients, their humeral bone rubs against one of the bones in their shoulder. It creates a lot of pain. And the patients typically are a little older. They used to like to play golf or play tennis, and now they have really bad options for care since it's irreparable. And our in-space balloon is a small bioresorbable balloon that almost acts like a little waterbed, a little cushioning waterbed between those bones that are rubbing together. And what it allows the body to do by reducing that pain is to actually be rehabilitated. So all of the muscles, even though the rotator cuff is torn, all of the muscles take over and they get strong again, and they compensate for the lack of a rotator cuff. And what we're seeing out of these patients in terms of lack of pain, increased mobility, getting back to playing tennis or golf has been really amazing. So we seek opportunities like that happen to be an acquisition, but we find those companies through our specialized people with deep domain expertise. We find those opportunities to take meaningful innovation to the masses at Stryker. Most of the time, those are small companies. They don't have the channel might that we have at Stryker. And we find those opportunities and we bring them and share them with the world, if you will.
That's great. And just final question about another acquisition, Gauss Surgical. I know it came up a few times, and actually in the conversation that I had with Kevin Lobo as well. How did that company come together? And talk a bit about why it's so different. I think Kevin had said that it's the kind of company that maybe haven't even existed 5 years ago, and now it's a big part of Stryker's plans going forward.
Yeah, Gauss is a really neat company. So if you think about what we are trying to do, and that is that journey to zero that we talked about, provide better, safer patient care, help our customers do that. Every 4 minutes in this country, this is hard to believe, I know, in our advanced healthcare system, but every 4 minutes, a mother dies from excessive bleeding during childbirth.
Wow.
And this postpartum hemorrhage issue is actually one that is uneven across socioeconomic lines, across racial lines. It's usually poor minorities that are impacted more. So it's really tragic.
Wow.
And Gauss has sought to do, and this is where Kevin was going with technology that may not have existed, is they've developed a system that uses machine vision, machine learning, and AI to determine how much, with precision, blood loss that patient is experiencing. Today, it's pre-Gauss, if you will, pretty archaic the way that our customers have to try to determine blood loss, and it's very imperfect. You'd be shocked to know that the percentage that our customers are off in generally in estimating blood loss is pretty extreme. So if you can have a degree of precision, you know exactly how to care for those patients, whether they need a blood transfusion, whether they don't. And the Gauss technology, again, using that machine vision camera technology to determine exactly how much blood is inside of a canister or how much blood is on a lap sponge that's being used, can give a degree of precision on how to provide care for that patient. So we're super excited about that, but that has very modern technology that sure may not have existed in previous times.
That's remarkable. That's a shocking amount of death that I didn't know it was that frequent. So those are the kind of things that stay with you. Wow. That's an excellent and important, I think, poignant way to end the conversation. It's great that you're working on all these terrific technologies at Stryker, and I'm grateful for the time you took today on the podcast.
Thank you so much for having me, Tom.
All right, Chris Newmarker, we're back with number 3 on your vaunted Newmarker's Newsmakers list. What is it?
Well, number 3 is related to the Omicron variant of COVID, which I don't know about. Tom, it sounds like a villain from the Avengers.
It really does. Yeah. It does
sound like of Omicron.
Sounds like he'd be fighting Optimus Prime. Definitely Decepticon variety. So,
well, now you're moving Transformers into this. Like you're,
why do we have
Avengers, Transformers, same thing. Omicron, yeah.
Listen, Disney doesn't own everything. I don't have to use MCU. We can bring in Transformers.
I was gonna do like COVID make Hawk angry.
Anyway, we have an article about Omicron, don't we?
Yes, Omicron. Well, I mean, with this new variant of concern in the world, and they're still, trying to, figure out how much more contagious it is, whatnot. But, definitely a lot of mutations, a lot of worry around it. We saw like a slew of medtech companies this week, reassuring the public that the test will still work with this new variant, even though it has all these mutations. I mean, we were hearing from like Abbott, BD, Hologic, PerkinElmer, Thermo Fisher, and just to top it off, we had the interim FDA Commissioner, Dr. Jan Woodcock, weighing in that at least preliminarily that there's a low likelihood that the tests are going to be impacted, and we'll know soon how much it affects the vaccines as well. Though it sounds like the Pfizer and Moderna CEOs, and generally what I'm hearing out there in the news is that it's the vaccines should still like keep us, knock on wood, keep us out of the hospital, especially if we have a booster. But like Pfizer, Moderna's top executives say they'll be working on a new version of the vaccine if they have to.
Yeah, the Moderna CEO, which is probably because I got the Moderna vaccine a couple of weeks ago, was fairly non-committal about its effectiveness. Basically, he said, I don't have the data, but it might not work, which I wish he just kind of stopped at. I don't have the data.
Yeah, I like that.
The might not work stuff really got played up. It's like, let's just wait and see. It's like, look.
Yeah, we just got to wait and see. And
everyone just stop throwing our arms in the air and running around in circles, and let the smart people figure it out. So
exactly, yeah, people shouldn't do their own research.
Yes, I'm going to trust the experts on this one. All right,
yeah. Don't listen to me about it either. I'm just like,
yeah, we would count ourselves amongst those people you should not listen to. We don't even listen to ourselves.
Exactly, but the companies that make the tests are reassuring the public, as is FDA.
Now, the question about the tests is, can they make more of them? Because they're very hard to come by, but hopefully we'll get that supply chain and workforce issue sorted out eventually.
Especially that even today, President Biden is announcing measures to get insurers to like pay for these. So I mean, obviously the demand could go up.
Yep.
So
I was talking with one contract manufacturer today, and they work with a diagnostic company or two, and their main challenge is finding workers to man the lines. Like they've got something over 50 open positions that they just can't fill, and they're doing the best they can to keep up with demand, but it's a real challenge. So
the challenge everywhere, and as we talk to different companies, we're hearing all kinds of stuff right now, like offering bonuses, whatnot, and it's still hard.
Interesting times. Let's move on to number 2 on the Newmarker Newsmakers.
Well, number 2 on the list, we got DePuy Synthes, buying Orthospin and its robotic external fixation system, and it's another surgical robotics play by J&J. So I mean, they already have their Veli's robot-assisted knee replacement system out there, and the the Orthospin tech, it's robotic, digitally enabled external fixation system, for orthopedic treatments. So yeah, really neat, really interesting.
Very cool. Now, I talked with, we'll be hearing from Kevin Lobo of Stryker in a few minutes, and we talked a bit about the competition that's moving in robotics-wise for Stryker's MAKO, and Stryker's pretty happy about it. They say the more robots that come in, the more conversations that are had about robotics, and the more Stryker's involved in those conversations. So they really see it as
the rising tide lifts all
a tailwind. That you might hear a rising tide mentioned in the podcast.
Oh, wow.
So, and he also hinted about, a possible interesting future for MAKO as well. So stay tuned. All right, let's roll on to number 1 on the Newmarker Newsmakers.
Well, number 1, we've got, Boston Scientific is initiating a clinical trial to evaluate its MCRM modular therapy system. This is leadless pacemaking. This is actually combining a leadless pacemaker with a ICD, that wirelessly communicate with each other. Amazing. So this is kind of like their play to compete against. I mean, Medtronic has had, a lot of success with their leadless micro pacemaker. Abbott now is, working on its, hopefully I pronounce this right there, a Veer leadless pacemaker.
I would go with a Veer, yes.
Yes, a Veer. So this is what Boston Scientific is doing in this space. And they've had the first procedures at Cleveland Clinic, and off we go.
Fantastic. This is all very cool technology and very important technology. So excited to see competition emerge in spaces as well. And we're seeing it here, or at least beginning to emerge. We're seeing with TAVR, seeing a lot of competition emerging in TAVR. So I think competition is good. I think everybody thinks competition is good.
And the lead investigator out of a Cleveland Clinic was like saying he thought this approach with the Boston Scientific system, could really benefit a large patient population too. Having a leadless pacemaker inside the heart communicating with subcutaneous ICD, you could really. He was saying he thought this could allow like the majority of lethal arrhythmias to be painlessly terminated. Versus, you can have implantable ICD shock can be painful for a person. So this could be a real improvement. We'll see how it goes.
Well, Kevin Lobo, welcome to the podcast.
I'm happy to be here.
It's great to have you back. I really enjoyed your Analyst Day call. It was very informative, a lot to go through, and it's going to really feed this interview. So we've got a few things to talk about. One, I want to kind of start off with the reorganization, or I don't know how you're classifying, maybe not reorganization, but you've realigned your 22 business units and went from 3 business segments into 2. I'd love to understand what went on behind that, why that was done, and how you came up with this configuration.
Sure. The first thing I'd say, Tom, is that it's not a reorganization.
I knew you'd call me on that. Yes. What is it?
It's really just realigning the external reporting that we do with the way we're structured internally.
Yes.
So most of the companies that I've worked in will have external reporting that is close to the internal reporting, but it's never identical. Mm. And today we have 2 group presidents, Spencer Stiles and Andy Pierce, and the businesses that they run are not neatly represented externally. Mm-hmm. So going forward, you'll see orthopedics and spine, which will be Spencer's businesses in one segment, and you'll see MedSurg and Neurotechnology in another segment, which is Andy Pierce's businesses. So it's just a cleaner reflection of how our businesses are aligned internally. The other change we're making externally is we're pulling out neurovascular as its own division. Mm-hmm. It used to be buried inside neurotechnology. And the other 3 groups we're going to rename neurocranial, which is CMF, craniomaxillofacial, ENT, and neurosurgical, which are powered tools for neurosurgery. So very subtle changes, same 22 business units that we've had before. They'll be reflected again in the new model. It's really just realigning for internal simplicity. So
the employees aren't getting new business cards or nothing like that. Okay.
Nothing like that.
What I'm just curious as to the pulling out of neurovascular. Does that suggest any sort of emphasis is going to be put on that? Or again, is it just got more of a bookkeeping strategic sort of realignment?
That change is just a reflection of the explosive growth that we've had with neurovascular. Mm-hmm. So when we bought that business about a decade ago, it was about a $250 million business. It's more than $1 billion now. It's been a tremendous fast growing business. And so it really deserves to be pulled out just given its size. So the fact that it's grown so explosively warrants it being pulled out on a separate line. That's the only reason.
Excellent. So let's move into growth. You talked a great deal about your growth and looking ahead for 2022. Listening to the analyst call, you said something that sounds. I'm sure anyone who went to business school knows the thoughts behind it, and it seems intuitively makes sense to me. But you said once you're already the leader in a space, the notion of doubling down becomes less interesting. That you really want to kind of find new tech and grow what you have, as opposed to making a big bet like you did with MAKO a few years ago. Explain that statement to me a bit. Flush it out if you would.
The strategy that we've had at Stryker since I've been CEO has been what we call category leadership, where we've tried to be the category leader, being number 1, number 2, you could say even number 3, as long as you have a meaningful number 3 presence. Being a category leader means you're relevant. The customers need to include you on any kind of bids that they're having. And you really have expertise and specialization and skills that can deliver value for the customer. Mm-hmm. So when I became CEO, we were not category leaders in spine, in sports medicine, in extremities, and we've now become category leaders in those 3 segments. And we've addressed all of the major gaps that we had to reach category leadership. But once you become a category leader, the idea of doubling down with similar products that look like what you have, you're just gaining scale. but not really any differentiation. And to me, that's an uninteresting way of deploying capital.
Mm-hmm.
MAKO was quite different because we brought new value proposition to our existing customers, as well as the ability to gain market share with a differentiated offering. So I'm not saying that we would never do a deal in a space where we're a category leader. We always have little tuck-in, little gaps in our portfolio that every business is always looking to add to expand their presence. But to do something large, the question was in response to acquisitions.
Mm-hmm.
And the question was, do you see yourself going out and buying something else that would give you a lot more scale when you're already a category leader? And I just don't believe that's a smart use of capital, that you're better off getting an adjacent technology, getting something new that's differentiating versus buying something that's very similar looking to what I have now just to make me bigger. Because once you're already a category leader, you already have a seat at the table. Customers are already inviting you in. You already have dedicated sales forces. So there's not much more to gain. Just being big for the sake of being big is usually not a smart way of deploying your capital.
Gotcha. I want to drill into M&A in a moment, but let's just talk a bit about your strategies for growth that maybe aren't merger and acquisition related. Looking ahead to 2022, how are you looking to grow the businesses you've got?
Every one of our businesses has a pretty exciting pipeline, and I could spend a long time going through every one. We do have some very exciting launches planned. In the hip category, we have a new stem that we're launching, which is a fit-for-purpose stem for the direct anterior approach, which is a less invasive approach to hip surgery.
Mm-hmm.
We had again, this is an example of a gap in our portfolio where we didn't have the ideal stem. We do have a stem called Accolade 2, which is used in the direct anterior surgeries, but there's another type of stem with a collar that a lot of surgeons like. We didn't have that in our portfolio. We are launching that at the end of this year in early sort of pilot procedures, and it'll be full launch at the AAOS meeting at the end of March. So that's one example of a very exciting new product. We have our Percuity bed, which is being rolled out gradually. We have 4 models, and we now have all 4 models now launched. And that'll be a launch that'll build over the next couple of years, a wireless bed, a new bed frame, which is very exciting, low height, tremendous smart features in the bed. Very excited about that. Our neurovascular business has a number of new product launches that are gaining steam into next year. And I can go on and on. Every single area has a number of products, but those are the 3 that I'd point to that are extremely exciting going into next year.
Interesting. The bed thing. The bed thing, your bed product. It was Spencer, I think, was making a presentation. I think it was his presentation on the analyst call, where he was sort of conveying that someone coming in from an accident is going to sit probably within 3 or 4 Stryker. I think he called them Stryker ecosystems, and the bed would be one. And he delivered it very well. But it occurs to me now that you're talking about sort of a wireless bed. I mean, that does present an opportunity for data collection, correct? I mean, having a bed that's synced up and connected. Explore that a little. Dig into that a bit, if you would. What are the opportunities there?
Absolutely. Not just the bed. Even MAKO is a robot that collects data. We have Physio Control, which has all kinds of connectivity. We have a number of our products that have digital features to them that are collecting data, and that data can then be used to have better patient care. In the case of our beds, fall prevention is a major issue for patient care. Mm-hmm. And this will connect wirelessly to the nurse call systems and alert a nurse if the patient lowers the post before they try to exit the bed. Those kind of automatic warnings will help prevent falls and really get the nurses informed about what's going on with the patient. And so that type of connectivity and these beds have tremendous amount of technology in them to measure patient movements. And if they're not moving enough, should the patient be turned? Many things like that that'll improve overall care. And we're just scratching the surface right now with what the future holds for this. And so we're very excited about continuing the advance around our smart bed. In addition to other features, like the low height feature is a great feature of this bed. It's the lowest bed, so you can sit on the bed and put your feet on the floor. Okay. Again, another reason why, if you know any patients, my mother is only 5 feet tall. She has a lot of trouble getting in and out of beds when she had to go for her surgery. And when I talked to her about this bed, she was wildly excited about the idea of easily exiting her bed or being able to get onto the bed.
My mom was slightly taller than that, but yes, I'm familiar with the dynamic. That's great. Oh, that's fascinating. So let's talk a bit about M&A. Let's talk philosophically in a moment, but let's drill down specifically on Wright Medical. You were celebrating the year-end close of the deal. There was a lot of talk about how successful an integration it was. What makes for a successful integration? And maybe in explaining that, how does that apply to what's gone on with your acquisition of Wright Medical?
I've been extremely pleased with this integration. It's been one of the best we've done in the time that I've been at Stryker. And frankly, if you look at implant integrations, they're very difficult. As you know, you've seen in spine, tricky integrations, and we had our own with K2M that was challenging. What makes for a good integration is if you have very little Salesforce disruption, very little customer disruption, which has been the case in this deal. And that's because we made very fast decisions around sales rep territory alignments, around the management structure. We decided to specialize into 3 separate business units: an upper extremities business unit, a core trauma business unit, a lower extremities business unit. That caused a lot of transition inside of Stryker. We even had branches that used to be responsible for both trauma and joint replacement that are now responsible only for joint replacement because we pulled the trauma out. Again, that creates a lot of risk when you have this level of change. And the fact that all of our businesses have moved very seamlessly through these transitions, we've had very little Salesforce attrition. Our customers are extremely happy. I've had a chance to interact with many of the surgeons on both the Stryker side as well as the Wright side who feel like they have not been disrupted through this change. So those are all the elements that I would point to. I would even say also launching new products. When you do these types of integrations, sometimes R&D slows down. Through all of this integration, we launched the new Perform humeral stem in upper extremities, and we have 6 product launches planned for lower extremities in 2022. So very exciting that this integration has not disrupted the new product engine and has not disrupted anything in the field. We continue to enjoy very good growth rates. Now, obviously, foot and ankle has been a little affected by the pandemic. It's more elective. The bunions and hammer toe procedures are more elective, but total ankle is doing exceptionally well. And the entire shoulder business is continuing to roll. It was already a high grower prior to the acquisition. It's continuing to go very, very well. So those are all the reasons I would point to that really say this has been a fantastic integration so far.
Do you go into an acquisition knowing how the integration will go just by looking at the parts of the company and think, no, that'll fit in nicely there, or that'll fit nicely there? Or is it really, does the smoothness come in the execution and the people involved in that integration?
People is the biggest part of every integration. People and culture, I would say, together. And their culture, we knew their culture was a good match for ours. It's proven to be the case, but the leadership has done a wonderful job. In this case, we have a Wright Medical person leading upper extremities, a Wright Medical person leading lower extremities, a Stryker person leading the core trauma, and of course, the Stryker president overseeing the overall business. Nice mix between Wright and Stryker. It's not that one group is dominating the other group. We're actually melding the two together extremely well. But leadership is always the key to these types of integrations going well. We had baked into our integration sales dyssynergies, which typically happens because you lose customers, you lose salespeople that defect and go to other companies. That's been very, very minimal, far below what we had expected and modeled as we did the acquisition. And we also were worried, I was worried about the impact to core trauma and to joint replacement. I call it shrapnel. I was worried that there would be shrapnel that would hit these other parts that weren't directly affected, that weren't the core extremities businesses. And both of those businesses have done very well. If you look at joint replacement, it's been affected by the pandemic, but competitively holding our own and not having any negative impacts. And core trauma is actually starting to thrive. I think their resources were somewhat diluted because they were spending time also on extremities as well as core trauma. Now we have laser focused, specialized business unit just on core trauma, and that business has done very, very well.
Interesting. Let's talk more broadly about M&A then, but focusing on Wright still, because I found comments. There was probably about 6 or 7 minutes of when you were set up there with your leaders and kind of a panel format. You were talking about M&A, and you had mentioned valuations and the fact that sometimes you need to wait for a company to grow into the valuation they were asking. And that was the case with Wright Medical. You've been monitoring it for several years and was finally at a point where you thought the price fit. I'd like you to talk about that, but I'm also wondering, does it also work with culture that you have to wait for a company to be kind of large enough to really fit into a larger company? Does that make it easier?
For me, the culture aspect is only important if it's a large company.
Okay.
Many of our deals are smaller companies and the culture match is less important. Mm-hmm. If I'm buying, just look at the in-space balloon as an example. Great product that we acquired, Israeli product, as you know, is now approved in the United States, has been in Europe for about 10 years. We're buying a product. We're not really buying a full company.
Gotcha.
In that case, culture is a little less important because it'll be the Stryker culture that will dominate post-acquisition, other than perhaps the R&D people that come along with the deal. But oftentimes we buy a product, we don't bring a lot of people with it. Mm-hmm. Then culture is less important because it'll end up being the Stryker culture that will be adopted. If we're buying something that's larger, that's bringing, in the case of Wright Medical, 3,000 employees with it, culture is very, very important. But we don't wait for companies' culture to mature.
Okay.
The timing of the deal is really based on the valuation. So in the case of Wright, we were very excited about their business years ago, but they were growing fast, but their earnings were very, very low. And over time, they continued the high growth and then started to develop a pathway to have improved earnings. And we're starting to improve their own earnings. And it reached the point where the math worked. And we just couldn't get the math to work earlier on when the stock was at $30 and their sales were half of what they are, let's say $500 million, and loss making. Mm-hmm. That math was challenging. Once their sales got close to $1 billion and they started making profits and the stock was still around $30, suddenly that became very interesting for us.
Great. So looking at potential deals going into 2022, you noted that you've done over 50 deals, you said, since you've been CEO overall. 9 years. Yeah. 9 years. You're mentioning that you're a market leader in many businesses already. You're less likely to make larger acquisitions in those spaces where you are market leaders. So do we interpret that to say that you're going to do mostly smaller deals and tuck-ins going forward, at least 2022? I don't know how far you can forecast out. What does that look like, do you think?
In the core businesses, we'll be focused mostly on tuck-ins, mm-hmm. but we will be looking at adjacencies more and more. Over the next 5 years, we'll be doing more of our deals in adjacencies than we have in the last 5 years. And just to define an adjacency, it would be a new technology, not necessarily a brand new business, mm-hmm. a new division that we'd report separately to the investors. 2 examples are Stage and Physio Control. You remember those acquisitions we did?
Sure.
Those became part of our medical division. Those were adjacencies. They were new defibrillators, a new technology for us. The Sage products were new products for the intensive care elements of hospitals, but they became part of our medical division. Those, expect to see more of those types of acquisitions from Stryker in the next 5 years. And they're not limited to small dollar values. They can be larger deals as well as we pay down debt and continue to generate cash. And frankly, we're doing extremely well on the pay down of debt. We're about 9 months ahead of schedule because of the successful integration that we've had so far.
That's terrific. So, and there was a conversation again within the call that just talked about, sort of about the state of startups. You first said that multiples have gotten high. We're talking about M&A and that, again, that Wright earned its way into evaluation. But then you said the IPO window frustrates us, but it's brought more money into medtech as a result. So I imagine, what is frustrating about the IPO window?
For the first 5 years or so of my tenure as CEO, the IPO window wasn't really open. Mm-hmm. And that was great for us because these companies they'd come to pitch their company to us.
Yeah.
Now they have 2 options. They can be bought by a strategic like us, or they can go IPO. And many of them have gone IPO and have had great success mm-hmm. with very high valuations. So it's not great to have that as a new competitive force, that they have that option. And those valuations then tend to run up pretty high. If you look at some of the companies that have gone IPO, some of them are very interesting to Stryker. And they're in spaces that are adjacent to where we play, and they're spaces I've mentioned in the past. But you look at their valuations on the public markets, they're sky high and difficult for us to pay a premium on top of that valuation. But it's been good for the medtech industry overall, and bringing more innovation is a good thing. Sometimes it means we'll have to be patient and wait for the stock to drop, or when I say earn their way into their valuation, that's from my point of view.
Sure, of course.
They may feel that they're fairly valued today.
I'm sure they do. Yeah.
It's in the eye of the acquirer. I feel that they have to earn for the way we value the company. They have to earn their way, or their stock drops, because being public it's not easy. Every quarter they have to testify now to their investors, and if they have a blip or two, it can be very painful, as we've seen with smaller companies that are single product companies that have something happen in the marketplace. They're more volatile. They trade, they move up and down much more in a more volatile manner than a company like Stryker does.
Mm-hmm. And you've mentioned
we'll have to sometimes be patient and wait for our opportunity. But it's good for the industry overall. But prices have risen, and it makes it challenging sometimes to make sure that we can deliver value. There are many assets that we like, but at certain price points, it's just not going to be value creating for Stryker, and we have to deploy our capital elsewhere.
You mentioned the elevators go up and down, and when the elevator goes down, there are companies
we'll be ready.
Yeah, and you've acquired companies in the past that have taken the elevator to lower floors, we'll say.
Correct.
Yeah, interesting.
Well, even MAKO, just as an example.
Yep.
When we bought it, you remember it wasn't the most popular acquisition.
I do.
Their stock had gone from $44 to $18 in a year.
Mm-hmm.
We paid $30, and people were outraged because 30 compared to 18 was a giant premium, but it certainly was a lot less than the $44 it was the year before.
Yep.
Just as an example.
We had Maurice Ferre on the show 6 months ago, and he'd given the great quote that you went and visited him in Florida.
Yes.
And told him, look, I'm willing to bet my job on this deal, but I'm not willing to wager the company. It's like, I thought that was great. But you also, one of the offshoots was that you said the startup environment, in your opinion, has never been healthier since you've been at Stryker. You're seeing a lot of new companies being created, and they're creating companies that you have purchased, like Goss, that you would not even have known, might not even existed 5 years ago. So,
correct.
So you're optimistic about the opportunity to acquire real cutting-edge technology, new companies developing cutting-edge technologies going forward.
Very optimistic. It wasn't 5 years ago, I was a little nervous, to be honest, thinking that maybe the runway of acquisitions would start to dry up a little bit. Feel very differently now. Part of it's the funding, the venture capital money that's poured into the system. Part of it's also digital. So being able to have smarter devices and all these digital tools has really opened up new avenues for innovation that frankly didn't exist 5 years ago.
And let's see. Actually, I want to talk quickly about the focus on global expansion. You mentioned the benefits of your transatlantic operating model, but then I want to get back into robotics and sensors and wrap up with a few other things. But globally, you were happy with your growth in Europe and outside the U.S., and you were saying you're overly weighted in the U.S., partly because of all the acquisitions you've made. How are you sort of balancing things out, your business in a global way?
We still have a giant opportunity internationally for Stryker. Our U.S. sales are about 73% of our total sales. That's overweight compared to a typical global company. Part of that's because we acquire companies that have a lot of U.S. revenue. And part of that is we still have terrific opportunities to expand. Europe has grown faster than Stryker's growth rate for 4 years in a row. We'll continue to do so, but it'll be a gradual climb. Emerging markets needs to be growing about 20% a year for Stryker, which it did in 2019, and needs to do that for the next decade. It's only 6% of our sales. We have a huge opportunity. So especially with these companies we've acquired, we now have to take those to international markets. If I look at something like the Tornier shoulder implants that we acquired from Wright Medical, we're just launching that in China. It's just being launched. So new product for them, new market expansion opportunity, which will be very significant. And those abound around Stryker. We have great leadership teams we've now put in place. We were poised. I was so excited at the end of 2019 that we finally found our footing in emerging markets. And of course, COVID hit, and that has changed everyone's world. But we still have significant opportunity to grow around the world, not just in the emerging markets, even continuing the pace that we've had in Europe and even in Japan with technologies like MAKO that are newer to those markets because of the regulatory pathway. We only have about 20 MAKOs in Japan. We have MAKOs in over 30 countries, but small scale in many of these markets like Brazil and Russia, where because of regulatory, they've only recently been approved.
I didn't want to spend any time on this, but I would love 30 seconds on, we're watching the Omicron variant. I wonder how Stryker, do you have like someone sort of assigned to tracking variants, to tracking surges? How are you just watching this global up and down?
We watch it the same way all of you do.
Yeah.
We watch the news. We obviously deal with hospitals. We have on staff a medical director that has a background in infectious diseases, and she provides us with terrific advice based on her background and her connectivity with the government, with the CDC. And we watch it just the same way you do. And it's been very frustrating, as you can imagine. We thought when we gave guidance at the end of the second quarter that much of this was behind us. The
Right.
Delta hit. Now we have the latest variant hitting. We still don't know at this point how big a deal this is going to be. We know it's spreading quickly, but we don't know yet how virulent it is, nor do we know whether these vaccines and the boosters that people have received, how effective they are against the variant. We'll learn more in the next week or two, but we're just learning to be resilient as a company. It's not been fun, certainly for the hip, knee, and spine businesses, which are most exposed during these periods of time when electives get shut down. Those businesses represent a little less than 30% of our sales, and those are the most impacted, and very difficult to manage a team when the goalposts keep changing based on what's happening in the exterior environment. But hopefully this will get put behind us before too long, and we're going to have to learn how to live with these rolling issues.
Absolutely. So
hospitals are getting better. Hospitals are getting better at dealing with it, which is good news. And hopefully the governments won't move into lockdowns.
That's a good point. No, we are least experienced at this. So quickly, I know you got to get going, but robotics. You sold your 1,000th MAKO. Was the numbers I thought were interesting.
We're over 1,300 now.
Oh, I'm sorry. I apologize. 13. I must have misheard that.
No, 1,000 in the U.S.
Oh, in the U.S. Okay. I think it was in the U.S. over 60. You said, I think Spencer said over 60% of the time. 60% of the time you're selling into a competitive implant account with your MAKO. So
correct.
So that's impressive. And that 1 out of 2 of your knee implants are implanted with a robot, which I thought I didn't realize it was that high.
It's a spectacular growth that we've had, far faster than I expected. The uptake, I really believed it was going to be compelling and we would have this strong adoption, but it's been faster than I expected. So we only launched the total knee application about 4 years ago, and we're up to fully launched it 4 years ago. And to be at 1 out of every 2 knees in the United States going in with MAKO is amazing. That's
great. So there's a number of companies that have rolled out their own systems. We'll be rolling out more systems, soft tissue, some orthopedics like you. You mentioned that you see those new players providing a tailwind to Stryker. Explain how that works and how do you compete with them? Because many are saying we're not a robotics company, we're a digital company. We're going to have sensors. We're going to have the whole bit. They're taking it, kind of carrying it 10 yards further up the field.
Well, first, let's start with robotics.
Yep.
Soft tissue robotics and hard tissue robotics. The soft tissue robotics, Intuitive Surgical is clearly the leader there. And you have Medtronic announcing that they'll be coming out with their version, which is being trialed in India right now, called Hugo. And then J&J has a program which will be launched in a couple of years, I believe. And then you have a number of other smaller companies. You have CMR in the UK. You have and probably another 24 small startup companies in the soft tissue space. That's not a place where Stryker plays today. It is a space where monitoring potentially one day would be something that we would like to be able to enter. Not obvious what the path for that would be at this point in time. And so that's soft tissues on one side. Within hard tissue robotics, which is where my commentary was made during the analyst meeting, I believe that it's a tailwind to have other players in the hard tissue game. We are by far the clear leader with MAKO, with, as I mentioned, more than 1,300 robots installed globally. We have a huge head start versus the competition. And more recently, J&J's come out with their version for total knee, but we have a robot that's for total hip, as well as partial knee, as well as total knee. And it's the same robot, just with different attachments for all three applications. And we believe that more players that come into the market creates more interest. And so those surgeons that, let's say we're, in this case, DePuy surgeon, gets to look at something that's robotic, that opens the door for them to also consider MAKO. And we love our chances side by side competing with any of the systems on the market. And I would love the water level of robotics just to keep rising, because we know we have a fabulous platform. And with hospitals buying their fourth and fifth MAKOs, we know that's not for marketing. They're buying those fourth or fifth robots because they're getting terrific outcomes, great results, and the surgeon and the patients are very happy with the product. It just brings more attention to the space, and we like our chances competitively.
And on the sensor side of it, what do you have to do to advance the robotic platform?
So sensors, to me, there are robotics, and sensors is just another technology. We call them enabling technologies. Mm-hmm. So there are technologies that help enable better outcomes. And sensors are different than robotics. It doesn't compete at all with robotics. It's additional, providing additional value. We brought OrthoSensor. That's our version of sensor technology that we're pretty excited about. Mm-hmm. I believe it's going to take time for sensors to really become tremendously value adding. Unlike robotics, which is you do the procedure, you see the benefit immediately when you're doing those procedures. In the case of sensors, we have to acquire data mm-hmm. over a period of time, determine which is the data that's the most meaningful. How is that data going to then provide predictive algorithms for the surgeon to know, okay, this patient is having a problem with rehab, or this patient with a BMI of this should get this type of an implant. So what you want with sensors is over time to gain knowledge, which can then be used to feed back to the beginning of a procedure or to improve the rehab of a patient post-surgery. That's going to take time. So I don't believe that sensors, I'm very interested. I believe it's going to be very exciting for the long-term future. But in the short term, it's all about gathering data. And then once you gather that data for a 2 or 3 year period, then figuring out what in that data is going to help provide tremendous value to improve outcomes longer term. It's going to take more time than people think in terms of its ability to create tremendous value over time. But I'm bullish on it long term. It's just not something that's going to be moving a lot of market share in the next couple of years.
Well, that's great. Final question. I just want to, when we spoke last, we certainly talked about efforts by the medtech industry to improve diversity within its workforce. I know it's an important issue to you. It came up in a conversation I had with Kwame Ulmer of MedTech Color a few weeks ago. He said they want to give you a seat with your name on the plaque because you're such a frequent visitor to their MedTech Color breakfast. So how are things going? First at Stryker, give yourself a report card. How have things gone this past year? And then maybe if you would just look around the sector, around the industry, and give us an idea how you see the situation changing, if at all.
I'm very excited with the progress, both at Stryker and within the industry. At Stryker, our employee resource groups are absolutely thriving. We did a survey on inclusion during the pandemic, and most companies' inclusion scores actually went down. Engagement scores went down, and ours actually went up modestly, which was terrific. And we believe that that's part of that is the focus on diversity, equity, and inclusion. We have diverse slates in 2/3 of the candidates that we've been hiring, and we've hired over 50% that have been diverse this year. So it's not just having more people to interview, but we're actually selecting a high number of diverse people. We have a training called Think Twice that we created internally at Stryker. Fabulous training on diversity, equity, and inclusion. 90% of our managers have been through that training. We set an audacious goal of 100% of managers getting the training done this year. We've already had 90% there, and we will get to 100% of managers. It's a fabulous training. Again, in-house developed, and it basically says the idea of Think Twice is that you're not responsible for your first thought. Everyone has a bias. It's not your fault. But you are responsible for your second thought and your first action. Mm-hmm. And it trains people to sort of accept your bias. Don't feel bad. It's not a shaming. We all have our biases. And so those are examples within Stryker. As for the industry, I passed my chairmanship over to Mike Minogue, as you know. He's maintained diversity, equity, and inclusion as a major pillar. We've focused a lot on clinical trials. We have Ashley McAvoy, who's leading a pillar around racial inequities and healthcare disparities. which is very exciting work. And so we're making progress in both attracting people to the industry and also dealing with disparities within healthcare. Very pleased on both fronts, the Stryker front as well as the industry. Still have a long way to go, but we're on a very, very positive trajectory. And as you know, this is something I feel very, very passionately about.
Excellent. Well, thank you for the work on that. Thanks for the update on Stryker, and thanks for joining us in the podcast.
Thank you. Fun to be with you.
All right. Well, that is a wrap. Chris, Newmarker. Now, we should tell folks that this little Newmarkers Newsmakers is a bit of a tease because you will not be here next week. Right?
Yes, I am taking a little bit of time off for the holidays. So,
but you'll be scouring social media for comments and posts, I'm sure. So how can folks connect?
It's hard to stay away. Just when I think I'm out, they pull me back in. No, it's such a fascinating field. So yeah, I'm on LinkedIn all the time. So, always happy to talk with people. Chris Newmarker, just like a Newmarker. And you can also find me on Twitter at Newmarker.
Awesome. And I am on LinkedIn, Tom Salemi. I'm on Twitter at MedTech. Tom, you can find this podcast many, many places. You can go to devicetalks.com, where we have this and our other podcasts, Medtronic Talks and Intuitive Talks, posted up there. We'll also have information about our upcoming in-person meetings and our ongoing Device Talks Tuesday sessions. That's all up there. So go to devicetalks.com. You can subscribe or follow this podcast on every major podcast application. And we would very, 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 very much appreciate it if you would share this episode of the Device Talks Weekly podcast on social media. And please
follow, subscribe.
There it is. We got to get the merch. We saw someone else had merch in our company. We need to get merch.
I am looking for the merch. Well, we will have merch at our, what do you think, Tom? We'll have the polo shirts or something at the Device Talks Boston.
If Chris Newmarker has to pay for it himself, we'll have merch available to people.
We're going to buy the merch for everybody? Wait a second, Tom. Wait, no.
If we get more podcast listeners, it's totally worth it, Chris.
My kids will lose their college education, but I'll be like, but look at these cool polo shirts. I mean, come on.
That's a wrap. Tune in next time for another great episode of the Device Talks Weekly Podcast.
Okay, stay safe. Happy holidays.